It's estimated that 800 women die every single day simply because they don't have access to basic pregnancy and childbirth-related health care.
Well, in a moment, we'll be joined by Martin Drury from the Health Poverty Action. But before that, Sadia Chaudhry has this for us.
Not everyone in this world is fortunate enough to have a glamorous pregnancy. For some new mothers, the story isn't so much about their health during pregnancy as it is about their figure. Celebrity new mum Kim Kardashian is insisting that she's not worried about losing what's called baby fat as she prepares to hit the red carpet again. And it's said the Duchess of Cambridge is to give birth to her child in the same hospital where her husband, Prince William, was born. The hospital has already suspended parking outside the building for the entire month, and royal sources say the baby, who will become third in line to the throne, is expected to be delivered by the Queen's very own gynecologist. But for hundreds and thousands of women across the world, pregnancy is a life-threatening risk. Until recently, every year, 500,000 women would die before, during or just after childbirth. Reports show that 99% of these women are in developing countries. Experts say maternal health in the developing world tells a shocking tale of preventable deaths and complications. Improving the health of new mothers and pregnant women is one of the United Nations' 8 Millennium Development Goals. It calls on countries to reduce maternal deaths and to increase better access to skilled health personnel during births. In some countries, like India, efforts are already underway to achieve better care for expectant and new mums.
So this JSSK provides for free transport to pregnant women, for bringing them to the house, bringing from their house, their homes, to the hospital, and after delivery, take them whether on same day, 2 days, 3 days, 4 days after.
The figures have somewhat improved, but are still described as scandalously high. Today, between 230,000 and 398,000 women die from conditions relating to their pregnancies. Some countries are making little or no progress to tackle the situation.
Well, shocking statistics there about something that really affects all of us in one way or another. Well, to discuss this and more, we're joined by Martin Drury from Health Poverty Action, who just this weekend organised a 5-kilometre march through London aimed at raising awareness on this very issue. Welcome to the show.
Thank you. Nice to meet you.
Yeah, nice to meet you too.
Indeed. Now, how did the event go at the weekend?
It went great. It went great, and I found it really inspiring. You know, because the thing about this, it was a small number of people. It's a massive issue. World-changing issue. And, in the past I've been involved, I was one of the organisers of Make Poverty History, so I've been involved with, sort of huge numbers. And, but I kind of find it more inspiring almost in some ways when it's, a comparatively small number of people that take it upon themselves to get something in the public eye, you know?
I mean, I can see the argument about quality over quantity.
Yeah.
How effective was it?
Oh, I think it was incredibly effective.
What was the outcome at the end of the day?
Yeah, well, you see, the thing was, the organisation that I work with, Health Poverty Action, it's an organisation that's locally rooted in some of the poorest countries in the world. So around the world, about 400 staff or so. But the thing about those 800 women that die every day needlessly, that it's hidden from the public eye because most of it's in very remote rural areas. Yeah. So the idea behind this march was that obscenity is only allowed to happen because it's hidden from the kind of. Let's do something in central London to bring it into the public gaze.
It's one of those things, as I said, it affects everybody, doesn't it? Because women dying needlessly, it's easy to think of it as a woman's issue, but of course every one of us was born from a woman, so it does affect absolutely everyone on the planet. And I think the key word is the needlessly. You understand sometimes when there are very complex medical situations or very unusual pregnancies, but you're talking about highly preventable stuff that with some basic interventions these people would survive, really, aren't
We're talking about the most basic interventions that most of us would take for granted. What brought it home to me once, I was visiting some work, that was indigenous area in Nicaragua, and I heard the phrase "one foot in the grave," and my ears perked up because I'm thinking, comedy, I love that programme,
That's right.
And actually, what the phrase meant there, it meant being pregnant. and the term for pregnancy was 1 foot in the grave.
That's
If
amazing.
your life's on hold, you can't make plans, you don't know if you're going to be here in a few months' time.
That's amazing.
Well, I spent a week in Pakistan recently and
Yeah.
spent the last 12 months raising money for maternal care in Pakistan.
Yeah.
It's interesting because we look up very advanced medical issues that might affect, or not having access to advanced medical care that might affect the issue. But it started off with the kind of village midwife who was untrained, who had just been brought it upon herself that she would look after the delivery, but she wasn't really well rooted enough in healthcare issues to be able to advise people. And that seemed to be the starting point, because after that, it just went downhill, unfortunately. And by the time women arrived at the hospital,
that's the problem.
it was too late.
You've got it, absolutely. That's absolutely it. You talk about the 3 delays: the delay spotting the complication, the delay getting people to the health facility, and then the delay getting treatment once you get there if there aren't enough health workers. But you're right; it's that interface between the traditional birth attendants in the local villages and the formal health system.
Martin, very simple things. For example, training midwives, having access to, many don't have access to maternal care, hospitals, etc. Is that right? That's
exactly right. And, what the people on the march on Sunday were calling for is a strengthening of the basic health system. So that you've got just a comprehensive package of care, accessible for all, free. It's got to be free, for the poorest, and accountable to the local community.
Look, the NHS, no matter what anybody says, is probably one of the most advanced systems in the world. How do we get a piece of that into Nicaragua, to Pakistan, to India, to all the rest of it? What do we do?
What you've got to build on what's already there, and so it requires campaigning. But I think one of the things is that what we've got to look at in the introductory film that you showed, it mentioned the Millennium Development Goals, and the trouble is those only measure average figures. And what we've got to start looking at isn't just what the average is, we've got to start looking at what the worst is. What are the worst conditions? And focusing on the gap between the worst in a country and the most privileged in a country.
As you said, because the average can often hide things, can't it, when you look at the average conditions. Speaking of average, our viewers at home, the average viewer now watching, what can they do? What can they do about this? Is it just about speaking to people about raising awareness? Is it campaigning? Is it writing? Or getting in touch with yourselves?
Yeah, well, by all means, our website, healthpovertyaction.org, full of things that people can do. I think one of the things that I've learned in sort of travelling around, so some of these poorest communities, actually, it's some of the people who've got the fewest resources in the world that are actually changing the world more than most. And whenever we're faced with something like this, absolutely tell people about it, tell people about the issue, tell them more needs to be done, point them in the direction of organisations where they can get involved. But I think we're always more powerful than we think. We can always do something.
Well, look, on a lighter note, before we go for our first break, what's your take on the tea thing?
On the tea
4 cups of tea a day? Are you
one
of them?
I'm from Yorkshire, so I was brought up on tea.
You brought up with
Doncaster, then Bradford.
With a fine cup of tea up there.
Absolutely,
Indeed,
Right. But I'll tell you, the best tea I've ever tasted was in January this year, Somaliland. Somali tea.
Really?
I had to drink it without the sugar.
We've got loads of Somali viewers. They'll be delighted to hear that.
Well, best tea I've ever tasted.
Really. And are you one that drinks several times a day, or?
I need a hell of a lot in the morning. Caffeine to get going.
Well, listen, thank you very much for being with us, and we pray that things go well for you. That is Martin Drury, Health Poverty Action.
Thank you.
A website you need to visit to try and support women and children around the world to prevent unpreventable, basically make sure that people are not dying unnecessarily.
That's right. Well, our question of the day.